and it's about potential treatments, medical treatments, not vaccines, for COVID-19. Do they exist? And if so, are they effective?
Right. So we do have some medications that we are using right now to treat COVID-19 in people who are infected. The two main ones that we use in the hospital, there is an antiviral medication known as remdesivir, and it appears to treat the illness. So when Dr. Zaman showed you that slide that showed two different phases of the illness, right? The first was the phase of the infection of the virus, and the second phase was the phase where the body is fighting the virus. So this medication is important in the first phase. Unfortunately, we haven't had much of that medication until recently. And so the studies that were originally done were done in people that had had the illness for a long time or who are severely ill. It may be that we find that these type of medications are used more effectively early, but that is one of the medications we have, and it's in the first phase that it becomes important. The other medication that we have is dexamethasone, which is a steroid, and that was studied in a very large trial in Europe where we had, maybe 9,000 people that got it. And that study showed that in people who were on oxygen, they got benefit from that medication. And so that is something to use. It is not something that we use in people at home that aren't on oxygen from this illness. It is not something we use even in people in the hospital who are not on oxygen, because in the study of many thousands of patients, it did not show benefit in people who were not severely ill or who were not on oxygen. In fact, maybe it certainly didn't help, and it's possible it could harm. And so for that reason, we don't use steroids. So those are two medications. The other thing that you may have heard about where the data are not as clear, but that we still use and are using that can help early on in the illness, probably doesn't help later, is something called convalescent plasma. So that is where you take the plasma or the blood of somebody who has already recovered from the virus, and you can give it to somebody who is now ill and their body hasn't had time to make the antibodies. So those are the three main medications that can be used. There are some newer things that are coming out, you may have heard about in the news. They're not widely available. There was a new drug that is available recently as an expanded use. It's going to be very limited. It's going to be very severely ill people, and we don't have all the information about it already. There are some things that were tried that were not effective and should not be given. I have seen still in the community, people are giving antibiotics for this infection, and they are not effective. So giving zithromycin is not effective for this illness. We do not give hydroxychloroquine for this illness. That was done early on because of some information we thought it might help. And then several large studies were done that answered the question. It does not help. And in fact, in many people may cause harm. And so we don't do that. So that's where we are in terms of medications. In addition to that, there is now a monoclonal antibody that is not widely available. We have very few doses of that that we received, and some people can get that. That is only for people to get before they become ill and end up in the hospital. It is for outpatients only, and it's for outpatients who have certain risks based on their age and underlying health problems.